Hello and welcome, world, to the For Your Best Self podcast. It's Dr. Saluja, and today I'm proud and pleased to host our rockstar esthetician, Michelle Smith. Now, I've known Michelle for 8 years. She's worked alongside me, and she, along with the rest of our team, one of our other great estheticians, Melissa Kern, helped me take care of the largest organ system in your body, our body, the skin. Welcome, Michelle.
Thank you for having me.
This is fun. Tell me, we get to talk a lot during clinic. We do some curbside consults. We try to sneak in a coffee. But tell me a little bit about yourself, maybe things I know or don't know, and a little bit of your story.
Okay. Well, I'll start by telling you a little something about myself that I have not told anyone. And it's just kind of fun. It wasn't fun, but it's taken me about 30 years to own this. So I'm just going to tell you how revelation, how I got started, or my introduction to what we would say into beauty. So I guess it's been about 30 years, but I was that girl who sold perfume out of her car, out of the trunk of the car. And I tell that story because for a while it was something that I was embarrassed to share. But I now, all these years later, realize that I learned to approach people. I learned how to read people. I learned how to become approachable. And it has been something that's carried over into this stage where I am taking care of people on a daily basis.
So how do people find you in the car or your car?
Oh, this has taken me way out of my comfort zone, but I approached them. I had, you remember Dracar, you remember all of those popular brands that, yes. So you just kind of learn to relax. It was a stretch, but
everybody wants to smell good.
Everybody wants to smell good. So now, of course, I'm challenged often to come out of my comfort zone, to stretch beyond what I'm familiar with. And it's a good thing. It's a good place to be.
That is a good place to be.
Yes.
You want to tell me anything else about you?
Well,
before we get into the hardcore esthetician things.
I will tell you, I've always known that I wanted to care for others, and that I loved caring for others. I have a lot of people know, but I do have a blended family with 9 children, two who are adopted, and
no gray hair or hidden gray hair.
Hidden well. Well, there are some perks to working for the best dermatologist and plastic surgeon. I have my 6th grandchild on the way.
Wow.
So
wow.
I
didn't know that.
That is it's very exciting, very exciting. But I'm in a position that I get to give credit to you all, because it's I've learned so much from both you and Dr. Novo, and you working hand in hand over the years about how to take care of myself, the health of my skin.
That's important. It shows over time. It shows the commitment to skincare, and obviously we guide, but you actually follow through, so it makes a big difference. Interesting you talk about your beauty story, because my foray into beauty was when I was in 5th grade, 4th, 5th, 6th grade. We had, for 3 years, my parents were teachers, so they had the summers off. We had a costume jewelry store in the tourist district in our town. And it was called, we had, I grew up in Sault Ste. Marie, Michigan, so there's a Sulaks. And so tourists would come in the summer when the weather was great and watch the boats. And we had a costume jewelry store, and I helped people find things for their ears, for their necks, that helped them look and feel more beautiful. Gifts. And then I also had to do the kind of the flyer handout, or put the flyers on cars. And so you start approaching people by, would you like to read about our store and come in and visit us? So it's interesting how times have changed. But we all have to have a start.
We all have to have a start, and yes,
somewhere, right? So tell me, what is an esthetician, and what does an esthetician do? I think sometimes people don't know, should I see an esthetician, or should I see a dermatologist, or should I see both? What kind of, is there training? Is there, I think some people are very familiar with the esthetician. They're coming all the time. Some people just really
Right.
don't know.
Right.
Do I need an esthetician in my life? And obviously our answer is yes, you need an
Yes, you
esthetician,
need an
in your life.
esthetician in your life.
But explain that a little bit.
So an esthetician, we're trained, we're specially trained to advise on skin treatments, skin care, all that involves your skin health. Whereas you, as the dermatologist, it's the diagnosis of skin conditions. And the two of us can work well together to help and customize that person's needs for best skin health.
That makes sense. Do some people, so a lot of our patients see both of us, right? So we may do skin cancer screening or injectables or lasers or some of the things that we need to have the dermatologist for. And then you are providing that bridge. I often view the esthetician as kind of the skin friend. So you're the friend of the patient that helps them work on their skin really long term, lifelong. And I'm more of the skin parent or the skin coach, and I kind of will diagnose or set the plan or help with a plan. And then really it's about having that relationship so you're committed to actually following through on that plan.
That's probably the most, what I love the most about being an esthetician. I'm fortunate enough to get to spend, an hour to 90 minutes with each of my patients throughout the day. And most of them, it's once a month. So I've established relationships. And with that comes some of our skin issues are very vulnerable. And,
true.
There are things that make people cry about their skin. And so I'm able, with your guidance, to walk these patients through a process that, and I tell people it's always a process. Nothing that we do is going to give you, just be patient and know that and trust me and trust Dr. Saluja, and we'll get there.
What are the top 3 things that a patient may see you for, or a person may see an esthetician for?
Okay.
Other than, one, health, skin maintenance, skin beautifying,
Sure.
skin maintenance, facials.
Right.
But beyond that, any conditions?
Yes, beyond that. So probably the most popular or the most common would be acne scars. So we're able to work hand in hand to get the acne under control, but then to correct the scars over time with collagen stimulation, of whether it's through a chemical peel or through microneedling, or the combination of those. Typically, it's something that we will do to correct once a month for multiple months, and then we maintain. So the relationship is ongoing. It's, we're able to check back quarterly if need be. Let's see, some of the other things that people will come to see me for after meeting with you. Sometimes we get little brown spots or on the neck or around they look a little barnacly, or skin tags. Those are things that people are embarrassed about, and they don't realize it's a very simple fix.
I think it's so rewarding.
It's so rewarding. And I had one patient that it warms my heart, because I've been working with her for about, I would say, 18 months. And she was a darker skinned, your skin tone a little bit darker. So there are some concerns about that. And so we slowly over time removed these
concerns about the procedure leaving pigmentation changes, right?
Yes, because
if you have acne, you can get brown after the acne, depending on skin color,
Right.
or if you have a procedure, you can get brown, or you can lose pigment, either
Right.
or.
So we have to know and understand the skin type and how to pre-treat and how to post-treat. But I saw this
Yeah,
patient.
I would say, I'm going to interrupt you there.
Sure.
Pre-treatment and post-treatment is really important.
Key.
Yeah, with what you're doing.
Right.
You're doing something, but you also need
Absolutely.
that partnership at home.
Absolutely. And we have to, we have that experience over time to know how the skin, often can respond, and how to prevent that hyperpigmentation. But this patient, for the first time, I saw her in our office, and she was wearing a V-neck, a low-cut V-neck shirt, and she was so beautiful and emotional. I still get emotional about it, because she hadn't been able to do that.
Right.
All
So it's
those years.
life-changing.
And so
Yeah.
we did it slowly, we did it gradually, and she and I meet every 3 months now, and anything that is new that's popped up, we just take care of.
Keep it under control.
Keep it under control.
That's the
Yes.
best way. So I like sending patients to you who have the acne scars, but also sun damage.
Oh, yeah.
Sun is harsh over time. And I think especially as you throw in, aging over time and sun over time, we start to see broken capillaries or
Yes.
dilated capillaries, brown spots, fine lines, and wrinkles. And there are things that, believe it or not, Botox and filler don't fix. And we really do. I know it's the quick fix and we want to try and see, but really some things do take a little bit more time and a relationship over time and some care. And
Yes.
they're actually, often the things that take the time are the most rewarding,
I feel that
rewarding
way.
results.
And it's
So-
rewarding for me, it really is. It's fulfilling for me to see, that smile, or it, as rewarding as it is for the patient and their skin health. Yeah.
As you know, I like to talk about synergy.
Uh-huh.
It's one of the words that represents our practice. And what advantages is there to see an esthetician in a somewhat medical environment, or really truly a medical environment that has a dermatologist and plastic surgeon? Are there advantages to seeing, I call you our rockstar esthetician, but you are a medical esthetician as well because you are in the medical environment. Advantages that you feel you
Well,
have.
in my opinion, there's no other way to see an esthetician. The spa versus the doctor's office. I have all of your wisdom. I have your training, your experience to guide and direct me. So, for example, one of the things we just talked about, if a patient comes in with active acne, I can then refer to you all, okay, let's see if we can get this under control, and then we'll move forward to work on
It's
the
combination.
skin. Yes, it's combination. So
Prescriptions.
yes,
and
medical grade skincare, medical grade, treatments, medical treatments. So there are great advantages, and like you said, not everything can be fixed by Botox and filler. Well, not everything can be fixed with, a
true.
microneedling or a peel. So then I'm able to pass on patients who've entrusted, their heart's desire to Dr. Novo for, whether it's for a little neck lift or even,
Well, I love the fact that we're doing medical peels, but then Dr. Novo is doing the deep peels, something called the header, HETTER
Yes.
peel, which is great for under eyes and around the mouth in combination with aesthetic
absolutely.
peels you do.
Absolutely. And it's interesting because I personally have had the header peel, and it is a huge favorite of mine. But
your eyes look bright.
it's the before and afters are amazing. But the header peel only treats, we're treating in the office those two areas, under the eye and around the mouth. So I'm able then to take those patients once they've healed and do a medium grade peel on all of the other areas to
Right.
stimulate collagen in those areas and to lift some pigment and even out the skin tone. So that's been a lot of fun.
Talk about a little bit about our 90 days to your best skin. It's 90 days to your best skin's our skin boot camp, if you will. And I think committing to something for 90 days, we're talking about a lifelong relationship, but the first step is 90 days. And I think that's doable, especially with monthly check-ins and monthly treatments. And the best part in 90 days is that you can see something change, which then makes it easier to be committed lifelong.
Right.
Do people come in? Okay, so is that one of your favorite things, the 90 days, or how do we?
Without a doubt, it's one of the best places to start, and it establishes that partnership because the 90 days includes 4 treatments, basically 4 treatments. There are some that are a little more. Some of the more medical treatments, we're offering 2 of those, but basically, you get 4 treatments, which I'm going to take care of in the office. They're custom, meaning I can change if I decide, we're going to start with a chemical peel and we're lifting the brown, and then we recognize there's some
hyperpigmentation
yes.
is a big
But then
concern.
it's going to, when we lift and that brown and even out the skin tone, you may see some redness. So then I may need to switch gears and say, this next treatment, I'm going to recommend an XLV.
which is
treat,
a laser,
which is a laser
that helps with redness.
Exactly.
Okay.
But the point is that it's a great starting point, and it's where that partnership begins, because it also includes their at-home skincare. So that's their part. That's their commitment. They're going to go home.
Right.
They're going to use their Nuderm kit, or they're going to use their Elastin kit, depending on what procedures we've selected for them. We choose the appropriate skincare regimen and for their best results. So we're working hand in hand.
I like it that we can customize downtime or
Yes.
pain, depending, some people are like, oh, nothing bothers me. Some people say I want no pain. Some
Right.
people say I have downtime. Some people say I don't have downtime.
Right, exactly. I don't have the recovery, or I'm in Zoom meetings. I can't have my face peeling. Well, then I can do a radiofrequency microneedling, or traditional microneedling. Even will give you about
What is microneedling? You keep talking about it.
Okay, so microneedling is we offer two in our practice. We offer traditional microneedling, which is in our office is skin pin. So it's a handheld device, creates a little micro injury, sends a message to your body that there's this injury, and begins to heal, stimulate collagen. We use it for acne scars. We use it for fine lines. We use it for texture. I do it in combination with we can do it in combination with PRP, if you're familiar with. We use
Platelet-rich
PRF.
plasma. That's
Yes.
where we draw the blood, spin it down, mix it with a nutrient matrix.
Absolutely.
And then inject under eyes or apply topically on the skin.
That's right. And that expedites the healing, too, from that process.
And we have some great growth factor solutions.
Yes.
And then we have Sculptra that we add to the microneedling.
Absolutely.
Which Sculptra is injectable, but it can also be used topically for helping stimulate collagen, which is really great for fine lines where injectables don't work as well.
Well, it's the microneedling has been a big favorite, and with those wow results, the other.
And no downtime.
Right,
which is
right.
great.
The recovery time with the radiofrequency microneedling is even less. And that device heat's being delivered at the tip of the needle. So it's safe for all skin tones, meaning if you're somebody
we're
who has-
bypassing the heat on the top.
surface of the skin.
Okay.
So if you are, if your skin tone is a little bit darker, it's okay. And we're going to get some firming from that. We're going to get, there are many ways that's going to benefit our skin in texture, in fine lines, also deeper scars, firming of the skin, and that too we can add all of these extras.
Yeah, I think for prevention
enhance.
it's good. Do you do microneedling on the scalp, and why?
Oh, I do microneedling on the scalp. I choose to use the radiofrequency microneedling on the scalp for a couple of reasons. It's virtually painless. And
you just turn the heat low.
I turn the heat low, but by having low heat, it almost cauterizes, so you don't get bleeding. It's more comfortable.
Yeah, nobody wants to see blood.
Nobody wants to see blood. So
I agree.
yes, I use that for overall scalp health. It's the same. It brings blood flow to the scalp, to that follicle, for the health of the follicle. And in our office we use a PRF to inject into the scalp at the layer so that those follicles can have nutrients brought. And in our office we use a system called PRF, and it will linger. Those nutrients from the growth factors linger there for 7 days.
That's
So
awesome.
It's
I think
awesome.
scalp and hair is often neglected, and when we're talking about anti-aging and looking youthful and feeling good about yourself, scalp and hair play a big role.
Yes, they do.
And that's one of the things I love to have people see you for, because that does require multiple visits and a little bit of a commitment. But it's so doable, and there isn't recovery. And then there's supplementation and topical solutions at home.
Right.
For example, Nutrafol supplementation, or topical Rogaine compounds, or minoxidil. We talk about compounds. There's a topical something called spironolactone compound, so that I can help with that. You can help with the treatments and getting them started. And it's, who doesn't want great hair? I wanted to ask you along that, do men need an esthetician? Do you see that?
As a matter of fact, yes, of course they do. Men, so, I have both sides where I have men that take excellent care of their skin by themselves, but then I have some who need a little assistance. They need a little guidance. They need someone. I have wives that send their husbands in because some men have some congestion around the nose, things that the wives
don't like the blackheads, or the partners don't like the blackheads.
They want those taken care of. So one of the treatments, one of the most popular treatments for men is hydrofacial, and that's a facial it's a deep cleanse, exfoliation, and then after a light
and painless.
Oh, it's
and
painless.
No downtime.
It's exactly
right.
After a light chemical peel, and it doesn't cause the skin to peel, but it kind of softens all that out, and then you do full face extractions. It's like it's a vacuum for the most part. But what men love about it,
and men can handle vacuums.
Oh,
this
for
is
sure,
good.
Men can handle vacuums, and then you can show them what's been collected from their face, and then they say, "Wow, it's tangible." So
that's true.
I can see this. This is a great place, for me to
cleaned.
And they look amazing. So yes, I do have men, and I do it for the back also.
They need help on the back.
Yeah, and men and women need help on the back.
Yeah, we forget it's a neglected area sometimes.
Exactly,
that's true. Tell me about what do you do personally for skincare? How can I ask how old you are, or is it a secret?
No, you can ask. I'm proud of how old I am. I'm 48, and for skincare, So I started out when I first came to you with a lot of sun damage. So I used the Nuderm system initially.
Which is made by Obagi.
Yes.
Which has exfoliants, sunblock.
Yes. Retin-A or retinol.
Retin-A, retinol, tretinoin.
And we use those interchangeably.
A lightening agent.
Yes.
An exfoliating agent. Hydration.
So I was able to even out my skin tone, and then moving forward as I matured, I personally like using the TNS Essential.
Which is now TNS Advanced by Skin Medica.
And so to me, it's simple because it's an all-in-one, but you have both the restorative aspect, the growth factors that, the proteins that we lose as we get older.
That's true.
And then the protection moving forward, the antioxidants.
So,
and I add hydration. I use what's called HA5, the 5 different hyaluronic acids. I use that. And then the total defense and repair is the sunscreen. It has a little bit of a tint to it, really lightweight, but for me, it works well, and that has anti-aging in it as well. So
it's nice to have products that do 2 things or 3 things at once as we get older, because rather than having to use 6 or 7 things, or now I got to use the sunblock, now I got to use my anti-aging, now I got to use a tint, now I got to use a hydrator, try to combine, and that's the beauty. Some people will, why am I spending $50 for a sunblock? It's not truly a sunblock. It's a sunblock with zinc and titanium, but it's also a product that has peptides for anti-aging or antioxidants or cover, so it's really an effective way to get multiple ingredients in one.
Yes, love that. And we can't forget the under eye. I do use we have a fantastic under eye cream that for me, the Elastin, that's the other part of my regimen that I don't want to forget.
That's true. We can't forget about
no.
And are you taking any precautions as an esthetician when it comes to cleanliness and extra precautions now that we are living in a pandemic?
Right. During this time, there have been some changes that we made that, first of all, I slowed down a little bit. I slowed down a little to take the time to, to give myself time to use a medical grade cleanser over every surface that's been touched in the room in between patients. And so that's been, patients are feeling comfortable. They're in a medical office and they feel more comfortable. Of course, I wear a mask. And now all of my services, I wear gloves, of course, and
it's fun to have pillows and fabric, etc., but it's not great.
I removed that. Yes, I did.
So we have become actually a little more medical.
Yes.
Or, if you will, sterile, but in a very purposeful way.
Exactly. And patients understand that. And they understand taking more time in between appointments. And I let them talk about it too, which sometimes they need to. Sometimes they need to talk about it because they're in a vulnerable position with, coming in for their service. But
I think whenever you're touching skin, and then sensitive skin like the face.
Right.
It is, and you're laying down. It's time for contemplation when you're in a treatment for yourself for an hour. Are tips reused or?
Oh no, never. I mean, we use even the hydrofacial is a tubing that's one-way tubing only, and I change the tips multiple times and clean that machine multiple times during the service.
Okay.
So
even within.
yes. So of course, no, we don't reuse any tips. Everything is disposable. Everything is sterilized in between, meaning all of the instruments that I would use
Are sterilized. Okay. And then we've added UVC light to help with air quality and improving aerosol, risk. So I think that's something that I've been proud of bringing on. I wanted to talk about some newer things that are coming up on the horizon or that we already have. And one of them is plasma pen. We have a plasma pen that's German made called Subnovi. And I think some people hear about it as fibroblast pen or and there are a wide range of them, and we specifically chose Subnovi because of its manufacturing and low voltage. But there is a week of downtime with that, with little dots, but why might someone do that? I've personally seen some patients with some amazing neck laxity results when their neck's starting to bother them. What have you been using it for beyond the neck?
Well, yeah, I definitely have had some great results with the neck. And you're able to kind of take that treatment up behind the ears and in front of the ears for more tightening and lift.
That's true.
But a lot of people will choose it because it's very specific to a specific area. So if they don't want to have surgery to improve their eyelids, or they're not open for that yet, we can treat in a way that we're going to get lift in the eyelids and around the eyes. So they like it for specific areas.
Yeah.
Lines around the mouth, that's another really popular use of that. So you can be specific.
Right. Any other things that are coming on the horizon or exciting you or relatively new?
The microneedling, the radio frequency microneedling has, we're, to my understanding, the only one that's utilizing, it's called Virtue. And that I'm really excited about because I have seen the amount of heat that you need, or energy, let's say the amount of energy you need to deliver to get that firming in the skin and get that toning, and is with this device, it's less painful for the patient, or less, let's say, it's more comfortable.
I've had our previous one and the newer one, and by far the newer one was well tolerable, so I was excited
to deliver that energy in less time to get better results for more comfort for the patient.
Yeah, you can
very
deliver
precise.
More energy.
Yes. I'm able to change the depths, so the heat's delivered to different depths in the skin.
Yeah.
And you would need different depths for different areas of the face. You would need
different thicknesses.
Exactly.
Thickness.
The under eye is you don't want to go too deep. That's more superficial. But acne scars, I'm able to go even deeper than a CO2 laser with this. I'm able to go deeper into the skin to help tighten, and so that I'm very excited about. The patients, I think, are too, the ones that have experienced both. I think, yes, they're able to, it's more comfortable.
Any final tips or answers to common questions that you want to share with us for today? We can do a part 2 down the road.
That'd be fun.
But anything that you think that comes up frequently, or you think that people should know?
One of the most popular questions, or one of the most the questions that I feel is a little bit of a myth, is that people don't think that they should use their Retin-A or their tretinoin or retinol. I use those interchangeably, but that they shouldn't use them during the summer because they're out in the sun, or they're out boating. And I feel like, yes, it's okay to continue to use your Retin-A. Of course, you need to be conscious of your sun protection. Whether it's reapplying your sunscreen or wearing your hat and your protective clothing, but it is okay to do it through the summer.
Yeah, I tell people, the sun's bad for Retin-A or retinol because it inactivates it. So as long as you're using it at night, and it thins the dead part of the skin, but thickens the living part of the skin. So I think there's a myth, it thins the skin. No, it's thinning what we call the kind of the dead skins on top. So you get that glow or that pinkness, but but it's really thickening the dermis where all the collagen's at.
Yes, that's the other thing that people, I don't think they understand. They always say it, oh, it's thinning my skin. No, but you're right. It's thinning that layer that we want to slough. We want that cellular turnover.
Anything we didn't cover that you want to tips or questions or things that you feel are important?
You know, I don't know if there's anything that we
I think
didn't
if people
cover.
haven't gotten a facial or haven't gotten a peel or haven't gotten a pick one thing and try it. It's kind of like you have to. Some things are hard to talk about and just make sense once you experience it.
Sure.
And I think a visit to the esthetician is one of those things. Once you experience it, then you should decide on whether it's right for you or not right for you.
Yes.
Because we can talk about it all day, but talking about a facial does not substitute for feeling a facial.
That's right. No, that's right.
And I think it's one of the things that I think, a hydrofacial or a dermaplaning facial where we're exfoliating the top of layers of the skin, or where you're starting to see how it makes you feel, and how do you look at yourself or treat yourself afterwards, and what confidence does it bring, and you'll know if it's doing those things for you, then you want that lifelong relationship, like the majority of people feel after those things. And if it's not right for you, at least you've tried it.
Right. Well, I think the best place to start, or a great place to start, would be a dermaplaning facial, in combination with the hydrofacial. That's just awesome. But people don't realize when you exfoliate the skin with a little blade, and you remove those dead skin cells and the peach fuzz, your products penetrate better, right?
That's true. And the products work better.
And I know this is something that I never heard talked about before I started doing it, but for those women who get breakouts, as it's some women and will admit to picking, but once you start picking at the skin, there becomes a little scab around the lesion or the blemish, and it's something that women don't understand. I can take that blade and I can kind of debride it. I can make it smooth, and it's just one of the little things that when they leave, they feel so much better about the breakouts and the fact that they were picking on their skin. So that's one that
that's true.
I'm really happy to be part of that relationship that I'm in a phase in my life now where I've given myself permission to take care of myself, and to be in relationship and help these ladies and men take care of themselves and to be part of their care is really, it's an honor. So, and I know what that feels like.
And I feel that from you. Yeah.
Yeah. Wow.
I think it's those small things that add up, right, in life. So I think that picking spot getting better, that facial hair better, that pimple not coming, that scar less deep, that brown spot diminished, those things can have they seem small, but they can have such an impact in other aspects.
Yes, I've definitely found that to be true.
Well, Michelle, it was a pleasure to spend some time catching up with you.
It's fine.
And I've enjoyed this time. Let's do it again.
Yes.
And everyone listening in, find us at Apple Podcasts, Spotify, and hit that subscribe button. And we look forward to talking again soon.
Thank you for having me.